Yeah. Thank you for the opportunity, respected seniors on the dais. For the next few minutes, I'll be talking on the validation of one of its novel neuro-ophthalmological application that we have innovated called the IMG Max, which is one of its kind. So when we see a lot of theoretical framework happens in neuro-ophthalmology, when a structure is referred in a textbook, such as undissectable structures like a cavernous sinus, a circle of Willis, or even any brain structures for that matter, including the eyeball, there is no proper way or proper representation. There are many apps today on 2D or 3D animated one, but there is no app which has a real-time 3D interface or a pseudo 4D interface, which I'd like to call. And this we have incorporated along with subtractive learning. So you as a user can subtract the structures that you want to. You can see the button being clicked is the skin is removed. You can also choose the skull. Now the skull is removed. You can choose different frames of choice that you really want to examine. The meninges can be removed, the brainstem can be removed, and the brain. So you can just go ahead and use the buttons of your choice. You can have the frame of your choice, and you can go inside out with virtual dissection just at your fingertips with your smartphone. And you can see here, this is on the left hand side, the buttons can be subtracted or added. Depending on that, the structures can be made available. So we had to read the anatomy, and we had to make sure we did reconstruct all these structures from the anatomy from scratch. I had to refer a lot of books and had to recalculate it so that you'll have no blind spot in anatomy of the ophthalmology structures as well as neuro-ophthalmological structures, and gave it in subtractive learning and virtual dissection with augmented reality. So these are all the models that you can see that is readily available, and this is an offline app which has been innovated. And on the right hand side, you can see the novel feature here is this is augmented reality with the LiDAR scan technology that all the smartphones have today. With zero cost, augmented reality can be loaded, and the models can be available on the table. With the fingers, you can just rotate it, you can go through it, navigate it, and at any point you can see the structure. So this is the learning app that was actually innovated, right? In the next step, you can see that we also made some simulators with the app. This is me taking the phone towards the pupil and then coming back. So this 3D spatial orientation was another one that was added. So this itself can work as an offline simulator as well, as you can see on the left hand side. And on the right hand side of the video, you can see that there were many counseling tools that were made available as well, that you can see in this video. So the purpose, we did validate this app to see how the level of the classes were there. It was a cross-sectional study, comparative study on a Google platform, and predominantly we had neophyte users who had the downloads. So we approached them, and the components of the questionnaire were pertaining to knowledge, comprehension, and additive scientific 3D features that they felt were very important, and we did have some tutorials as well. And these were some of the highlight questions that we did ask them regarding the satisfaction of the curriculum, regarding the innovative methods that really helped them compared to the textbook teaching. Compared to this, we did have a satisfaction score, and through the mail, 217 invitations were sent, and we had 203 respondents, and the study period was had to 1 week. And the technical quality, the scientific satisfaction, and the financial aspect was also evaluated as to how they felt it comparable to with this application and without this application. And it was satisfied, neutral, and dissatisfied where the responses arrived in a simple parity test, and it was significant. And I won't say it is that big a response, because 97.4% was happening with the app, and without the app also it's like 87% of the people were comfortable with reading. But this, my dear friends, is one of its kind where a three-dimensional orientation is needed, and it's order of the day in ophthalmology, where we have so many different three-dimensional structures. And when it comes to learning and pedagogy, because that is where it really starts. And this is not only applied in pedagogy, we can have the e-counseling stations, a simple procedure from a YAC PI, anti-VEGF injections, and retinal surgery counseling with the patient's own images. So we have used the patient's own fundus images, own angle images, own as much as neuro-ophthalmic images as possible to reconstruct this dimensional app. So according to our knowledge, there are no application till date which incorporates real-time, high-resolution, augmented reality images and photoreal visuals for interactive 3D learning. So this is the QR code. This is an offline app free of cost. You can scan this today and have this app in your smartphone today. It's offline. And neuro-ophthalmic concept learning along with ophthalmology is very immersive, and it also aids in patient counseling. And above all, we have also given a three-dimensional application model also for the same. If any user wants to download the app and as well as print their own models, such as the cavernous sinus or the circle of Willis that I'm having in my hand, they are also free forward to do it if they want to have it in a much digital way of expression. So this is the QR code, my dear friends, and immersive learning is the future. I think from neuro-ophthalmology is where we have to start with, so that the next set of batch is trained very well. Thank you for this opportunity.
Very nice presentation. You have mentioned that it is more of augmented reality. Is it augmented reality or it is more of auto segmentation? Because what I feel from the app, it is going more for auto segmentation, number one. And number two, if it is augmented reality, then can it be customized and use it intraoperatively? That is what we want to be a very safe surgeon when we work in some very critical zones.
Yes, ma'am. This is actually augmented reality, ma'am. To an extent, I would say this is mixed reality or even
Yes.
extended reality. These three terminologies goes hand in hand. For want of time, I'm not able to do the demo, but in this, with the augmented reality, it can transcend to surgery as well. So, as you told about the intraoperative planning, for
Mhm.
surgical transition, the smartphone alone may not be enough. That is where the HoloLens or the GeoLens, which is another part of my innovation, where I am working extensively on it also. With that, I think one or two people wearing the headsets, you can transcend into surgical innovations as well, where we have created the template. This template, we can superimpose a MRI or a CT picture of the patient, or even an MR angiogram or a CT angiogram can be superimposed. And then, if you are dealing with a vascular tumor, or if you're dealing with a non-vascular tumor, or whatever it is, I think you can go ahead and then plan the surgery with the headset, HoloLens headset. So that is also possible, and we have also done that also. So that is the next level, is what I believe. Yeah.
Okay. Thank you.
Thank you, ma'am.